You are listening to N.A.M.E Broadcast Radio, serving top professionals from all over the globe, with our international host, Mr. Steve Barron.
Good afternoon, everyone. In a moment, I'm going to introduce a very special guest we have here today. But first, I'd like to take a moment to tell you a little bit about him. He's been in the healthcare industry for over 25 years, written and co-written numerous articles, lectures on anti-age management and anti-aging issues worldwide as a self-employed plastic surgeon in private practice out of Las Vegas, Nevada. I'd like to welcome Dr. Julio Garcia. Dr. Garcia, how are you doing today?
I'm wonderful. Thank you very much.
Very, very good. Now, I have looked over some of this information. You and I have spoken before. Your credentials speak for themselves. But before I get there, I'd like to dial the clock back a little bit. Give me a little bit of insight. Tell me when you felt the moment or the time or something that led you into this industry of healthcare.
Well, it actually came as early as 13 years old. My father was a physician, as was his father. And we emigrated from Cuba, and when I was 13, my father, who had been an orthopedic surgeon, wanted to get me interested in medicine and follow in the family footsteps. So he introduced me to a friend of his to spend a little time with him in his office, and he happened to be a plastic surgeon, and I saw what he did, and he let me work and help do things around the office. And looking at the type of practice he had, which is really literally head to toe, I thought of the medical specialties I had been exposed to through my father. This was the one for me. And literally 17 years later, I graduated from my training in plastic surgery and started private practice.
Very, very, very good. Now, I see here you do both plastic surgery, but both surgical and non-surgical. Now, I'm not sure everybody understands what that is. If you could explain that a little bit.
Sure. Surgery, obviously, I think is self-explanatory. It's what people consider, eyelid surgery, facelifts, liposuction, breast surgery. But the non-surgical options really have become quite popular. These include non-invasive, non-surgical ways to tighten the skin with either lasers or radiofrequency. It also involves the use of neurotoxins such as Botox or Dysport to weaken muscles to make wrinkles look less visible. It involves using fillers like Juvederm and Restylane to plump up wrinkles in the face and hollowed out areas with Sculptra. So there are many patients that aren't ready for a surgical intervention. Some people are afraid. Some people just need a little something to carry them through between surgical interventions. And it's probably one of the largest growing facets of cosmetic and plastic surgery. And it's been embraced, interestingly enough, by men because men don't want surgical results and they really seek to look better, and this is a great option for males.
Okay, very, very good. Now, I see here you also do some type of a treatment here where you assist in chronic diseases and acute injuries as well?
Yes. With my work in plastic surgery, I got exposed to fat cells, and there's been recent evidence of using fat cells to be able to remove certain components of them. And we do a procedure called stromal vascular refraction. It's done under investigational review board. It's been looked at by the FDA. And what we do is try to treat not only chronic but also acute injuries with cells that are extracted from these fat cells. And these can include stem cells and also include some things called cytokines, and we can inject that into a knee or a joint or other areas of an injury and accelerate the healing. And it can be used for chronic and acute purposes. My clinic is affiliated with about 25 other clinics where we're doing this research on a national basis, and it looks very promising for the future, certainly.
Okay, very, very good. Now, I see here you're a member of the American Association of Aesthetic Plastic Surgery, American Society of Plastic Surgery, American Board of Plastic Surgery, American Board of Facial Plastic. People out there sometimes say, I need to have plastic surgery. I want to go have plastic surgery. What advice do you give somebody who's even considering something along these lines?
Sure. I think it's a frequent question, and there's a lot of people out there due to the financial restraints on medicine where people that are not plastic surgeons are doing surgical types and non-invasive, non-surgical issues too. So I think the first thing is to find out if your surgeon is board certified by the American Board of Plastic Surgery. What that does, it lets you know that the person completed a full plastic surgery residency training has taken his written exams and also passed an oral examination to make sure they're competent, and they've had years and years of training in this specialty. There are physicians out there that go and take a 4-hour class and then learn how to do liposuction and go back to their office. And they may be an anesthesiologist and an ear, nose, and throat or a gynecologist, and nothing against those specialties, but if they wanted to do that, they should have studied to be a plastic surgeon. So doing a little research, even on the web, finding out from my website, my board certifications, I think is the greatest place to start.
Okay. We're speaking with Dr. Julio Garcia out of Las Vegas, Nevada. Now, I see also you are a tactical physician for the Las Vegas Metropolitan Police Department since 2001, and as a team leader, you provide medical care during SWAT operations. Tell us some more about that.
Sure. That's a volunteer program that there's 8 physicians here in Las Vegas that are on the team. We go out when the SWAT team goes out to serve a warrant or have a barricade or a hostage rescue situation or a mass casualty event. What we do is function similar to military medics. The physicians we have on the team will go out and extract an injured person, whether it's a police officer or an innocent bystander or the perpetrator, and bring them out to a safe zone and render care in an area where an ambulance would not be allowed due to safety constraints. So we're trained very similar to military medics. We provide advanced care there until the patient can be stabilized and put on an ambulance and then transported back to a hospital in the region.
Okay, very, very good. That's very important. I also see here, Doctor, you lecture on age management and anti-aging issues, and you do this really on a worldwide basis. Is that true?
Yes, I actually, not only here, but I also consult for age management clinics around the world. I have a friend that I help down in Argentina, and I'm part of a 18-member clinic in Chennai, India, that we provide age management issues there, and I'm getting involved with another company that I can't release the name yet because it's still in development, but we're looking at opening a place in Delhi, in India, on a very large scale to include not only age management but plastic surgery and holistic living and nutrition. So we're looking forward to launching that hopefully in the next 6 months.
Okay, very, very good. Now I see here Crime Stoppers of Nevada. Talk to me about that a little bit.
Yeah, I got involved in that because of my exposure to the police officers. Mm-hmm. What Crime Stoppers is an organization that receives anonymous tips about crimes that have been committed in a certain area. Patients or people can call in and give us that information anonymously, and then if it leads to a felony arrest, they get money for that tip. It's all very safe and secure. Their name is never exposed, and it helps the community stay safe. And what I do is I'm one of the board members trying to raise money so that we can reimburse these individuals that help the police out in capturing felons, and it can include everything from robbery to homicide. So it's quite successful. It's on a nationwide basis, but I'm on the board here for the Nevada chapter.
Okay, very good. Now, you were also awarded the American Society of Aesthetic Plastic Surgery's Two-Lung Song Award for philanthropic service back in 2011, and the Clark County Juvenile Court Department of Juvenile Justice Citizens Award. Talk to us about that for a moment.
I was very fortunate to be honored by both the city and the court system and also by my peers in plastic surgery for 2 programs that we were doing. I've been involved in them for, I think, over 7 years now. The first is that we take juveniles that have been involved in crimes, especially gang-related crimes that have gang tattoos, and after they've gone through their scenario with the court system, we will remove any gang tattoos off of these juveniles in order to allow them to get back into a productive life. It's kind of their reward for being good and getting out of the system. And we also provide a similar service for victims of human trafficking. It's very common for these women that are being part of a human trafficking situation that they're tattooed by their owners, and when they get out of that system, we help them by removing their tattoos so they can get a gainful employment, move on with their lives. So that's what the awards were for, and I'm very happy to be recognized by my peers.
Very, very good. That's something that one doesn't really take into consideration, but when you mention it, it is very, very important, and we appreciate your service in that capacity.
Thanks.
Is there anything new on the horizon for Dr. Julio Garcia? Maybe 2 or 3 years down the line, is there something you're working toward?
Well, I think the advancement of the stem cells is certainly going. I'm part of a company that's raising some money to do some research in that. And also looking at just expanding the non-invasive aspects of plastic surgery, along with the anti-aging. Anti-aging is a constantly evolving field. So even though I'm a trained surgeon, if I can fix a problem or make a person feel better without surgery, I'm always looking for that. So we're looking at a lot of different technologies, the development of more stem cells application, and also looking at non-invasive technologies such as radio frequency to provide care and help patients that don't want to have surgery. So it's very exciting. It's very patient-driven versus other medical specialties. When patients say, hey, we want something that will help this, plastic surgeons in general are very innovative in developing new technologies with big companies that will address those needs. So we move much faster than traditional medicine in terms of our improvements.
That's very good, and I tell you, it's very good to hear somebody like yourself, a plastic surgeon here, dealing with anti-aging issues and really talking about the possibilities of non-surgical procedures. That's very, very important. Now, again, we're speaking with Dr. Julio Garcia, a private practice here in the state of Nevada out of Las Vegas as a plastic surgeon. Now, anybody has any questions out there, obviously he has a website, and I'm sure the questions can be answered. That's www.lvcosmeticsurgery.com. And I got to say, Doctor, it's been my pleasure speaking to you, and I look forward to us speaking again.
Wonderful. Thank you very much for the opportunity.
You're very welcome, Doctor. Thank you so much.
Thanks. Thanks again.
You got it.